Thank you all for joining. I'm Vanessa Albritton, here to provide information on open enrollment and upcoming changes for the new year. Presenting with me today are Rob Jarzombeck and Melissa Rucker. So we have several important topics on our agenda today, and we'll go ahead and get started. So what is open enrollment? Well, it's an annual event that usually takes place in the fall. This year, it starts on September 15th and ends October 10th. It's also the one time of year you can newly enroll or make changes to your health enrollment without a qualifying life event. But you must be eligible for CalPERS health coverage. All changes made during this time will take effect in the new year, January 1, 2026. So during open enrollment, you can enroll into a CalPERS health plan for the first time, change your health plan, add eligible dependents and or remove dependents, or cancel coverage altogether. So last year we got a lot of questions about where to find dental and vision information. So I'll highlight some details. Open enrollment for state and CSU sponsored dental and vision plans is also September 15th through October 10th. State and CSU members can find guidance and contact information on the dental and vision benefits page on our website at calpers.ca.gov/members dental vision. If you're currently employed by the state of California, you'll reach out to your department's personnel office regarding enrollment or dental plan changes, You can also learn about plan options and premiums by visiting CalHR's website, which we link to from our webpage. If you're employed by CSU, you'll contact your campus personnel office or visit CSU's website, which we link to as well. Now, if you're a retired state or CSU member, you would contact us, CalPERS, regarding enrollment or dental plan changes. However, for information about your plan options and premiums, you'll want to visit the CalHR and CSU resources that we link to on our dental and vision benefits page. So for vision, state and CSU members should contact their department or campus personnel offices, while state and CSU retirees should contact VSP Vision Care directly. For public agency and school members, if you're currently working, you'll want to contact your employer. And if you're retired, you'll contact the agency you retired from for any questions about dental and vision. Again, this information can also be found on our dental and vision benefits page. And I also want to share that for our state retirees, CalHR is hosting a virtual event specifically for you on Tuesday, September 30th, from 1 to 3 p.m. Pacific time. During this event, they'll share information about open enrollment, dental, vision, and other retiree eligible benefits. You can visit the CalHR Retiree Stakeholder Forum webpage to register, and that link can be found on our dental and vision benefits webpage. Now let's cover the 2026 health plans and changes. So first, we wanted to provide a snapshot of all the health plan options we offer. So these are our basic plans. We have 10 HMOs, and with an HMO, you get care from doctors and hospitals in the plan's network. You usually pay smaller copays, no deductible, and won't deal with claim forms. Coverage is limited to a set service area. We have 2 PPOs. These allow you to see any doctor, but you'll pay less if you use in-network providers. There's a deductible, and you'll share costs through coinsurance, so the plan pays part and you pay part. And we have 1 EPO. With an EPO, like an HMO, you must use doctors in the plan's network. Unlike an HMO, you don't need a referral to see a specialist. You pay copays, no deductible, and coverage is limited to a set service area. The EPO plan is only available in 18 of the more rural counties in Northern California. And we'll cover our Medicare plans in a few moments. There are also association plans, which are only available to members who belong to these associations and pay applicable dues. Each plan offers basic and Medicare coverage. So now for the 2026 updates. We have service area changes in Monterey County. Blue Shield Access Plus will replace Trio here. Monterey County members currently enrolled in Trio will be automatically enrolled in Blue Shield Access Plus unless they make a change during open enrollment. Now we'll talk about our PERS Gold Basic Plans Value-Based Insurance Design, or VBID. So VBID is a program that aims to improve health outcomes by encouraging preventative care and the use of health services while reducing member costs. While not new, here's some important updates for 2026. With VBID, you can lower your inpatient deductible by completing healthy activities, which earn you credits. Each qualifying activity is worth $100, and members can earn up to $500 in credits per year. Dependents other than a spouse or domestic partner automatically receive all 5 credits at the start of the year, but credits will not exceed $1,000 for a family. It's important to note that you won't receive a statement for this, so you'll want to track credits and monitor progress through the Included Health website or mobile app under the deductible tracker. So this is the expanded menu of VBID activities for 2026. Complete a short depression or anxiety screening from your provider, which you can self-report through Included Health. Complete a preventative screening or receive an immunization. These can add up to a maximum of $400 in credits, and they're usually tracked through claims. You can also self-attest to a flu or COVID-19 vaccine through Included Health. Get a second opinion from a preferred provider or through Included Health before any non-urgent or non-emergency elective surgery. If you have a chronic condition like asthma or diabetes, for example, you may be eligible to participate in Included Health Care Management Program. Credit is awarded after an intake with a case manager. In 2026, credits won't automatically be applied. You will need to take steps to get a second opinion or participate in care management to earn the credit. And if eligible, you can earn credit by participating in the Diabetes Prevention Program. The credit is awarded once you've attended at least 2 sessions or engaged with the app within the first 2 months. And your provider will determine if you're eligible for the program. So the main things to keep in mind are that subscribers, spouses, and domestic partners must complete the activities themselves to receive credit. Other dependents automatically receive all 5 credits at the beginning of the year, but the combined family credits will not exceed $1,000. You can track your progress and self-report some activities directly through the Included Health website or app. And to learn more about 2025 and 2026 details, visit calpers.ca.gov/VBID. That's VBID. So now I'll turn it over to Rob Jarzombek, Chief of our Health Plan Research and Administration Division, to share a brief update on our new Pharmacy Benefits Manager and talk to us about the basic PERS Gold and Platinum PPO plans.
All right, thanks, Vanessa. So CVS Caremark is replacing Optum Rx as the Pharmacy Benefits Manager for many of our health plans starting January 1st of 2026. Specifically, CVS will provide outpatient pharmacy benefits for Anthem Traditional and Anthem Select Basic plans, and Anthem's Medicare Advantage plan. Also, CVS will provide outpatient pharmacy benefits for Health Net's Saluti Moss, both the PERS Gold and PERS Platinum Basic and Medicare plans, Sharp's Basic Plan, United Healthcare's Alliance and Harmony Basic plans, and Western Health Advantage's Basic Plan. This slide shows which plans will not be affected by our change from Optum to CVS. These plans are all of Blue Shield's plans, so Blue Shield's HMOs, so Access Plus and Trio, Blue Shield's EPO plan, and Blue Shield's Medicare Advantage plan. Also, all of Kaiser's plans are not impacted. So this includes Kaiser's basic plans and Kaiser's Medicare Advantage plans. Sharp's Medicare Advantage plan is also not impacted, nor is UHC's Medicare Advantage plan. Here are a few of the highlights on the change, and these highlights apply to both basic and Medicare members. First, pharmacy access remains similar, as most members can continue using their current pharmacy. There will be some formulary changes, and there may be changes to copays. However, the number of members affected by this is low. You will still have access to the safe and effective medications you need. There are plans in place to ensure a smooth transition for filling prescriptions impacted by a formulary change, and for an automatic transfer of approved prior authorizations. For Medicare members affected by this change, which are again those enrolled in Anthem's Medicare Preferred plan, their Medicare Advantage plan, and those members in PERS Gold and PERS Platinum Supplement to Medicare plans. For these members, your pharmacy benefits will be administered by SilverScript, which is an affiliate of CVS. SilverScript and CVS work together, and really the only difference is branding and the appearance of the materials members receive. Today, we mailed a letter to Medicare members in these plans introducing SilverScript, and the FAQs on our webpage have been updated. To learn more about the PBM transition and to review a list of frequently asked questions, we encourage you to visit our website at www.calpers.ca.gov/CVS. We're also hosting a special PBM webinar next week on September 18th, and we encourage you to tune in. We'll share why we're making this change to CVS Caremark, and we'll have experts from our health team and CVS there to provide an overview on the transition, including the various communications and resources, and how we are supporting you, our members, through this process. Also, watch for upcoming communications from CVS for basic plan members and from SilverScript for Medicare members to ensure you understand what to expect in the new year. Now let's talk about CalPERS PPO plans. We often get questions about how our basic PERS Gold and PERS Platinum plans are different and how the benefits work, so we wanted to provide some helpful insights. First, let's go through a quick comparison between the PERS Gold and PERS Platinum basic plans so you can get a sense of the key differences. With PERS Gold, the service area is limited to California, so it's designed for people who mainly live and get care within the state. It offers lower monthly premiums compared to PERS Platinum, which can help save on upfront costs. However, you may face higher out-of-pocket costs when you use care, like deductibles or copays. But as mentioned earlier, participating in healthy activities through our VBID program can help lower your inpatient deductible. Overall, this plan is ideal if you're comfortable with those trade-offs and your healthcare needs are mostly within California. The coinsurance for this plan is 80-20 in-network, meaning the health plan pays 80% and you pay 20% of the allowable amount for services received in-network. However, once your maximum calendar year coinsurance responsibility is reached, the plan pays 100%. Now let's talk about PERS Platinum. This plan provides coverage nationwide and even internationally, so it's much broader than PERS Gold. The monthly premium is higher, but the advantage is that you'll usually have lower out-of-pocket costs for services, like lower deductibles, copays, or coinsurance. PERS Platinum is especially good for people with ongoing or significant healthcare needs, or for those who travel frequently or live outside of California. The coinsurance for PERS Platinum is 90-10 in network, so the plan pays 90% and you pay 10% of the allowable amount for services received in network. Once your maximum calendar year coinsurance responsibility is reached, the plan pays 100%. And I'll share more about coinsurance in a moment. This slide digs a bit deeper into the basic PPO benefit design. While it is not a comprehensive list, it does represent some of the more common covered services. You'll also see a column for the HMO benefits for comparison. These benefits are generally the same across all HMOs, and there is no deductible or coinsurance with HMOs. So let's focus on the PPO benefits and the differences between PERS Gold and PERS Platinum. With the PPOs, there are deductibles and coinsurance for covered services. When receiving care in the preferred PPO network or in-network, you'll pay the 20% or 10% coinsurance depending on the plan. When receiving care out of network, you pay more. The deductible is the amount you pay before your insurance pays. As shown here, your deductible is lower if you receive services in network, which is why we encourage everyone to visit preferred providers. Another important note here is that the in-network and out-of-network deductibles are counted separately. So if you visit a non-preferred or out-of-network provider, the amount you pay does not count towards the in-network deductible. Once your deductible is met, your coinsurance comes into play. Coinsurance is the percentage of the bill you share after your deductible is met. This is the 80-20 and the 90-10 split I mentioned earlier. With PERS Gold and PERS Platinum, there's a maximum calendar year amount you're responsible for before the plan begins paying 100%. However, if you go out of network, the amount you pay for those services does not count towards the amount you're responsible for, meaning it will take longer to get to the point where the plan pays 100%. In contrast, with an HMO, you cannot go out of network to receive services. If you do, you are responsible for the total cost of the services provided. The HMO plan does not pay any portion. For a detailed breakdown of all the benefits across all of our plans, we encourage you to review the Health Benefit Summary. You'll also find this information for each plan in their individual Evidence of Coverage documents. And if you have more questions or need any assistance in navigating your PERS Gold or PERS Platinum Basic plan, please call Included Health or visit their website. Included Health will help you keep track of your deductible and coinsurance progress, help you understand your benefits, match you with a doctor, and help you understand your claims if needed. Now I'll turn it over to Melissa, who is the Assistant Chief of the Health Account Management Division, to talk to us about Medicare. Melissa?
Thanks, Rob. So we get a lot of questions about the differences in Medicare plan types. So we wanted to provide a quick reference guide that outlines at a high level the differences between a Medicare Advantage HMO, Medicare Advantage PPO, and Supplement to Medicare. We've also listed our Medicare plan options for each plan type. Now, with a Medicare Advantage HMO, you work closely with your primary care doctor, who coordinates most of your care. When you stay in the plan's network of doctors and hospitals, you usually only have co-payments, no extra costs beyond that. But if you go outside the network, you'll be responsible for the full bill, unless it's an emergency or urgent care when you're out of the area. One more thing to know, HMOs are limited to certain geographic areas, and you must live in the planned service area. Medicare Advantage PPO plans typically give you broad coverage nationwide. With a PPO, you don't need to pick a primary care doctor, and you don't need referrals to see specialists, which makes it more flexible than an HMO. With this type of plan, you have access to a network of preferred providers, but you have the option of seeing a non-preferred provider. And if the provider accepts Medicare, your plan will cover the same share of costs both in and out of the network. All Medicare Advantage plans, both PPO and HMO, are approved by Medicare and get monthly payments from Medicare to provide your benefits. To enroll, you must live in the planned service area and remain there, and your enrollment does need approval by Medicare. Now let's look at our Supplement to Medicare plans. These plans cover all 58 counties in California And they also give you out-of-state coverage. You don't need to choose a primary care doctor, and you don't need referrals to see specialists. There's a network of preferred providers, but you can still see non-preferred providers. The way billing works is that your provider usually bills Medicare first. Medicare pays its portion, and then your health plan steps in to cover certain costs that Medicare doesn't. In most cases, your provider, Medicare, and your plan coordinate payments automatically. The key thing to remember is whether your provider accepts Medicare payments directly. If they do, you're protected and won't be responsible for charges above the Medicare limits. But if they don't, you could be stuck paying more. And if a provider doesn't participate in Medicare at all, neither Medicare nor your plan will pay, which means you'll have to cover the full bill. All of this information and more can be found in our Medicare enrollment guide, and you can get there quickly by visiting calpers.ca.gov/MEG. Now we'll go back to Vanessa to talk more about open enrollment.
Thanks, Melissa. Now we'll cover some helpful open enrollment resources. So new this year, we have a centralized location where you can access all open enrollment resources. This is a screenshot of part of the page, which will guide you to information on how to prepare for open enrollment and where to go to explore your health plan options so you can shop and compare plans and premiums. Below that, you'll also find links to information on behavioral health programs, where you can review resources organized by each health plan. There's also a link to our health and wellness page. This is where you can find out which plans offer things like gym memberships or access to fitness apps. You'll also find direct links to a variety of publications here and the path to all the health plan's evidence of coverage documents. So here are a few of the publications I'd like to highlight. Our health benefits summary, which Rob referenced earlier, provides a general overview of health benefits and compares covered services, co-payments, and benefits for all plans. The Medicare enrollment guide, which Melissa just referenced, was enhanced for readability this year, and it provides information about how Medicare works with your CalPERS health benefits. And the health program guide, which was enhanced last year, describes basic health benefits, eligibility and enrollment, and how life or employment status changes can affect your benefits and eligibility. Now, the most valuable open enrollment resource of all is your CalPERS account. This is where you can access customized information and your health plan statement, which I'll talk more about in a moment. You'll see special messages that pertain just to you here, like if your premium is increasing by 9% or more, or if you're affected by the pharmacy benefits manager transition we discussed. CalPERS is also where you can access the Search Health Plans tool. This tool allows you to search for health plans available in your area, and you can include your doctor or medical group in your search to see other plans that you can access them through. It also displays monthly premiums and member satisfaction ratings for each plan. And you have the option to compare plans to see side-by-side differences in premiums, copays, and benefits. You'll also find contact information and links to each health plan here. Most members can make health enrollment changes online, but active members, you must check with your employer first, as they may want you to follow a different process. Now we'll talk about the ways we communicate with you. So this week, you should have received an email announcing that your health plan statement is available online in your CalPERS account with a link to the open enrollment newsletter. And for those who have chosen to receive these items by mail, these materials were mailed to you on Monday. Your health plan statement provides custom information, including a summary of your enrollment, your current premium, and what your future premium will be if you don't make a plan change. And this information is always available in your CalPERS account. The open enrollment newsletter provides health program highlights, changes to health benefits, and other important information to help you in preparing for open enrollment. New this year, it's available in Spanish. So there's a QR code on the back of the newsletter that will link to the Spanish version. We also have links to both the English and Spanish version on our website. So even if you don't make a change during open enrollment or don't plan on changing, you'll want to review your health plan's premium for the next year. Premiums change every year, so you don't want to be surprised by an unexpected change in cost. And here's an overview of the emails we started sending in July and what you can expect through September. Since we send a lot of communication through email, it's important to keep your email address up to date in your CalPERS account. And in addition to email, we routinely share open enrollment information through perspective blogs, social media posts, CalPERS web ads, and letters. So this year we mailed letters to members affected by the pharmacy benefits change to CVS Caremark, those in a plan with a premium increasing 9% or more, Monterey County members enrolled in Blue Shield Trio, and today, as Rob mentioned, we mailed a letter to our Medicare members introducing SilverScript. Now we'll talk about all the ways you can make changes during open enrollment. So retirees, there are several ways for you to make changes. Online through your CalPERS account, you can mail or fax us your request. Call us at 888-CalPERS. Walk into one of our regional offices and speak with a specialist. Or you can schedule an in-person visit or a phone or video appointment through your CalPERS account. And active members, those currently working, check with your employer on how to submit your changes. They may have a specific process they'd like you to follow. So this year we took a different approach with our Q&A section. To answer as many as possible, we asked for your questions in advance. This allowed us to organize them into categories and have our team of health experts provide answers. So the first category is general open enrollment questions with Anthony Williams.
Hi, thanks, Vanessa. Okay, so the first question is, how can I confirm which health plans my provider or medical group accepts? And how can I know if the primary doctor, specialist, or group that I prefer are covered by the insurance? And the answer is the Search Health Plans tool is the perfect resource to check which health plans accept your provider or medical group. You can provide the name of a primary care provider or specialist, as well as a medical group, and the tool will list whether or not the plan in your area accepts that provider, along with satisfaction ratings. Remember, you are always encouraged to confirm any availability directly with the carrier before making a change. And question number 2, what health plans offer health and wellness programs, preventative care programs, and other perks? What kinds of benefits are offered, like gym memberships, nutrition classes, behavioral health, acupuncture, and chiropractic options? And the answer to that question is all of our health plans offer health and wellness programs, along with various other perks. The benefits include, but are not limited to, gym memberships and health and nutrition classes, wellness coaching, discounts on several different wellness activities and memberships, as well as acupuncture, individual and group therapy, and more. The offerings can vary by plan, so be sure to check out the details at www.calpers.ca.gov/health wellness programs. And as Vanessa had mentioned, there's also links to those pages on our OE resources page. And then last question for the general section is, how do I calculate my cost? Where can I find the health plan premiums, and where can I find out how much my employer contributes? So there's a few different angles to this because there's state and public agencies as well as retired and active. So we have several different resources to help you calculate your cost. The health plan premium amounts and state employer contribution amounts are located on our plans and rates pages for both active and retired members, located at www.calpers.ca.gov. And for the active members, those site is /active member plans rates. And the retired link is www.calpers.ca.gov/retiree plans rates. And additionally, state members specifically can visit the CalHR benefits calculator located on the CalHR website at eservices.calhr.ca.gov/benefits calculator external. Public agency and school members should contact their employer, current if they're active, or their former employer if they're retired, for their contribution amounts. And to determine your out-of-pocket amount, you would deduct your employer contribution from the gross premium amount. Additionally, members can log into their MyCalPERS account and see their current premium as well as their future premium amounts if they do not make a change, as previously mentioned, during open enrollment. And while they're there, they can also utilize Search Health Plans tool to compare health plan premium amounts, as well as co-insurance amounts, co-pays, and annual deductible amounts, and more. And that's the end of our questions. Or my questions, sorry.
Thank you, Anthony. So next we have enrollment and eligibility questions with Richard Ramsey.
All right, thank you, Vanessa. So my first question is, why isn't a provider or medical group contract termination a qualifying event to change your health plan? And the reason is changes to medical groups and contract terminations occur often and throughout the course of the year. These are not qualifying events to change health plans. Most of the time, contract negotiations are successful in negotiating a new contract and the services are maintained. While we understand the confusion and anxiety created by these events, as a purchaser of healthcare, CalPERS cannot guarantee that you will be able to indefinitely continue your relationship with your provider if your provider or health plan ends their contract. It's also important to note that the California Department of Managed Healthcare requires that health plans have sufficient providers available in each health plan's network at all times to provide services to all members. So if a contract is not negotiated successfully and you are in a course of treatment, you are also able to request a continuity of care plan to complete your treatment with your current provider. Once the treatment is complete, you will receive services with an in-network available provider. However, members who are not satisfied with their access to healthcare can appeal to CalPERS in writing, and these will be evaluated on a case-by-case basis. And the next question I have is, how often and when during the year can a provider or medical group negotiate their health plan contract? Can members be notified prior to open enrollment to make an informed decision? As far as how negotiations work, most providers or medical groups have multi-year contracts, typically lasting 3 years, but the negotiations can take place any time of the year. And sometimes the timing does coincide with open enrollment. CalPERS believes it is inappropriate for providers and health plans to involve members in contract disputes. The CalPERS policy on potential provider disputes is to allow the parties to continue negotiations and to work towards resolution without advantaging one side over the other by intervening or allowing members to change plans during the negotiations. To do otherwise might result in a health plan conceding to an unreasonable reimbursement demand that could eventually result in higher premiums with healthcare coverage if it appears the contract termination will occur. If your health plan provider terminates their contract with a health plan or ceases doing business for financial reasons such as insolvency, your health plan will arrange for you to be assigned to another medical group or will attempt to contract with them directly. And the next question I have is, can members change their health plan when they move? What are the permitted events in which members can change their health plan outside of open enrollment? So yes, moving is actually a qualifying event to change your health plan. Other qualifying events include retirement and Medicare eligibility. With these qualifying events, you have 60 days from the qualifying event date to request a health plan change. And for more information on this, you can visit our life events section on our CalPERS website. And then the next question I have is, if a member's child is disabled, what paperwork is needed to add the child after 26 years of age? So disabled children are to be enrolled at the time of the initial enrollment or are to be continued on the member's enrollment from before age 26 to be eligible for our health program. The required paperwork is our Disabled Dependent Member Questionnaire and Medical Report. It's also referred to as HBD 34. We also have an authorization to disclose protected health information form, which is form BDS 35. And that form authorizes the doctor to release the information. Excuse me. We do not need this form back. It's just for the doctor, and it authorizes him to send the information to us. Your doctor might have a different authorization form they'd like you to complete, and that is fine as well. Just understand we do not need any authorization forms back. The Disabled Dependent Member Questionnaire and Medical Report has a portion for the member to complete and a portion for the doctor to complete. And the doctor must send the completed form back to CalPERS directly from the doctor's office by fax or by mail. All of the instructions are on the HBD 34 form, and the forms can be found on our CalPERS website in the Forms and Publications section. All right, so the next question is it possible to add a parent as a dependent for health insurance due to a loss of coverage? Who is eligible to be a dependent for health coverage? And so the answer to this one is parents are not eligible for employer-sponsored health plans. Eligible dependents include spouses or your registered domestic partners, natural adopted domestic partners or stepchildren, children that you have assumed a parent-child relationship with and are considered the primary parents, and certified disabled dependent children age 26 and older. More information regarding who is eligible can be found on the CalPERS website under the Enroll Families Member section. And my last question is, so it's a member retiring in October, and he understands that he is covered under his same health plan and will transition to a Medicare plan December 1st. But if he wants to change his health plan, does it have to be effective January 1st of 2026 for open enrollment? And so Medicare eligibility and retirement are both qualifying events to change your health plan. Under this scenario, you can change your health plan effective December 1st with a qualifying event of retirement or Medicare eligibility. Very often in a different scenario, we see members change their health plan due to retirement and later become eligible for Medicare and change their health plan again as both are qualifying events. More information can be found on our Medicare retirees webpage. Turn it back to you, Vanessa.
Thanks, Richard. And now we'll have Melissa join us again for questions about Medicare.
Thanks, Vanessa. So the first question we received is, am I required to enroll in Medicare while I'm still working? Do I then change to a Medicare plan? The answer is, if you're working past the age of 65 and you're covered by CalPERS plan or another employer group health plan, you are not required to enroll in Medicare. If you're eligible for premium-free Part A, you can enroll in Part A when you turn 65, even though you're working. This won't affect your CalPERS coverage, and you'll stay in a basic plan until you retire. About 3 months before you turn 65 or before you retire, if you're working past 65, you should enroll in Medicare Parts A and B if you're eligible for premium-free Medicare Part A. For most members, we'll receive your Medicare information directly from CMS, and your health coverage will automatically change to a CalPERS Medicare plan. If we don't receive your Medicare information directly from CMS, and that's the Centers for Medicaid and Medicare Services, we'll send you notices that we need you to respond to in order to keep your CalPERS health plan. So it's really important to keep an eye on your mail around this time, so you don't risk losing your health insurance with CalPERS. The second question I have is, what happens to my dependents when I go on Medicare? So the answer is, when you enroll in Medicare, but you still have dependents that aren't yet eligible for Medicare, you and your dependents will be enrolled in what we call a combination plan. So this means at least one family member is enrolled in a Medicare plan, and at least one family member is enrolled in a basic or non-Medicare plan. All members of your family must be enrolled in plans with the same health carrier. Some of our carriers do not offer CalPERS Medicare plans. So if you're in these plans and you'll be enrolling in Medicare, you may need to change your health carrier. So for 2026, the carriers that don't have Medicare plans are HealthNet and Western Health Advantage. So if you're in one of those plans and you're turning 65 this year, you can change plans during open enrollment or within 60 days of enrolling in Medicare. Next question is, I retired with lifetime benefits. Why do I have to pay for Medicare Part B, and is this required? So the Public Employees Medical and Hospital Care Act, or PEMCA, which are the rules that govern the CalPERS Health Program, require that retirees enroll in Medicare Parts A and B if you're eligible for premium-free Medicare Part A. So as it sounds, Medicare Part A is free, but CMS does charge a monthly premium for Part B. And those Part B premiums will be deducted from your Social Security check, or if you're not receiving Social Security yet, you'll receive a quarterly bill from Social Security. If you are a state of California or California State University retiree, you may be eligible to receive a reimbursement for some or all of your Part B premiums. Next question is, do I apply for Medicare when I turn 65 or during open enrollment? So if you're retired, you should apply for Medicare 3 months before you turn 65. You'll apply for Medicare with the Social Security Administration during what they call your initial enrollment period, which starts 3 months before your 65th birthday. We start mailing letters about the Medicare enrollment process to our members 4 months before you turn 65. So pay attention to your mail. It's important that you provide us timely information about your Medicare enrollment, because your CalPERS health coverage could be canceled if we don't receive your Medicare information before your 65th birth month. And my last question is, when I apply for Medicare 3 months before turning 65, will my current health plan remain in effect until Medicare kicks in, or does my current health care plan expire on my 65th birthday? So even though you apply for Medicare 3 months before you turn 65, your Medicare benefits aren't effective until the month you turn 65. So your CalPERS Medicare plan will have the same effective date as your Medicare benefits, and you won't have any gaps in coverage.
Thank you, Melissa. Now we'll turn it over to Dr. Albers with questions about benefits and coverage.
Thanks, Vanessa. So let's see, my first question is, if I change health plans, how do I select a new primary care provider? Will my medical records and prescriptions transfer over to the new provider? So if a member changes health plans, they will need to review the plan's in-network provider list online and then select a new in-network primary care provider from that list. Another option is that they can call the health plan's member services line and ask for assistance in selecting a new in-network primary care provider. Medical records can be transferred by requesting them from the previous provider, but that does often require a medical release form. For prescriptions, members will want to coordinate with their new primary care provider and the pharmacy for transfers. And we encourage members to first verify medication coverage under the new plan and to also schedule initial appointments with your new primary care provider so they can get to know you. So next question, do pre-existing conditions affect health coverage or the ability to change plans? No, they do not. CalPERS health plans comply with federal and state laws, including the Affordable Care Act. Under the Affordable Care Act, or the ACA, health insurance providers cannot deny coverage or charge higher premiums based on pre-existing health conditions. CalPERS health plans provide guaranteed coverage to eligible members regardless of their health status or pre-existing conditions. Next question. For ongoing medical events, such as pregnancy and childbirth, how is insurance handled when plans are changed during open enrollment, which is effective January 1st, particularly if that childbirth is in a few months later? How is billing and the insurance handled? So when a member changes their plan during open enrollment, the previous plan will cover pregnancy-related services up until December 31st. And then the new plan will start services or start coverage of services January 1st and beyond. Providers will bill each plan separately, and deductibles and out-of-pocket maximums will reset with the new plan. Members should confirm that their hospital and their OB-GYN or their obstetrics provider are in network with the new plan, and they may need to obtain new authorizations for certain procedures. The member will need to communicate clearly with the plan and the provider for proper billing. But for any questions, members should reach out to their new health plan. How do members ensure there are no delays in treatment when switching health plans during open enrollment? How does continuity of care work, and how do members know if they are eligible? When switching health plans during open enrollment, members can take steps to avoid treatment delays and maintain continuity of care by reviewing the new plan's coverage, coordinating with their current provider, checking any pre-approval or prior authorization requirements, and contacting the new plan early to confirm coverage, in-network providers, and steps to continue care without interruption. Members who voluntarily switch plans during open enrollment are not typically eligible for continuity of care. However, any member may make a request for continuity of care to their new health plan for the treatment of ongoing acute or chronic conditions, including pregnancy. Again, members should contact the new plan to check eligibility for continuity of care. Next question. How can a member find a plan that would best cover a specific set of services for a particular condition? How can a member find out if specific services or drugs are covered? To find a plan that best covers specific services for a condition, to best assess your healthcare needs, you want to review the new plan's evidence of coverage and their summary of benefits and coverage, and then verify the provider network and any associated costs like your premium, the deductibles, and the copays. To check if specific services or drugs are covered, always review the plan's evidence of coverage, including the medical drug coverage, and you can contact member services for any clarification or more specific questions. You'd also want to proactively compare plans to ensure the selected plan aligns with your medical needs and budget. In addition, we recommend you review the new Pharmacy Benefits Manager, which is CVS, review their evidence of coverage to verify if drugs are covered. Okay, last question. Members have heard a lot about vaccines in the news recently, especially the COVID vaccine. So can members still get a COVID vaccine if they want one, and will it be paid for? The short answer is yes. CalPERS remains totally committed to supporting our members' health and well-being. As you may have seen or heard very recently, the Food and Drug Administration, or the FDA, announced that while the latest COVID-19 vaccine is ready for fall 2025, it's now limited to people who are 65 years of age and older, or those between 6 months and 64 years old who have at least one condition that puts them at high risk for severe outcomes from COVID-19. It's very important to CalPERS, however, to ensure that we continue to provide our members with evidence-based preventative care. So because of that, we have communicated and provided guidance to our health plan and our pharmacy benefits partners, that's Optum currently, and it will be CVS starting in January, that we will continue to provide and cover the latest COVID-19 vaccine for any CalPERS members aged 6 months and older who would like it. There will not be any cost sharing, and it will not have the recent FDA limitations. So we will be providing the COVID-19 vaccine as we have in years past. And this is consistent with the approach recommended by the California Department of Public Health. There have been no changes to the recommendations for the other 2 seasonal vaccines, the flu and the respiratory syncytial virus, or RSV. So members can continue to receive those vaccines as they have in the past as well. And that's it. Vanessa, I'll turn it back over to you.
Great. Thank you, Dr. Albers. And now this is our last category with Rob, and he'll answer some questions that came up about our health plans and the pharmacy benefits manager transition.
Yes, thank you, Vanessa. So the first question is, which health plans can cover my dependents who are living out of state? And the second, a follow-up question to that is, can my dependents be enrolled in different health plans? So all of our plans allow for urgent or emergency care for members traveling or temporarily away from home. However, if you have an eligible dependent residing outside of California, you might consider Anthem's HMO plans or Blue Shield's HMO plans, as these include certain programs for dependents who are temporarily away from home. Additionally, PERS Platinum is available nationwide as well as internationally. So we encourage folks to refer to those EOCs or contact the carriers directly with specifics of your situation. Now, the question about enrolling in different health plans, Melissa had talked about this a little bit earlier with PEMCA, the laws that govern us. They do not allow for members of the same family to be in different health plans. So all family members have to have the same health plan or same health carrier if you're in that combination plan that Melissa talked about earlier. Another question, what health plans are available outside of the United States? So only the PERS Platinum plan is available for members who are residing outside of the United States. Another question about services overseas. Do I have health insurance? Do I have health insurance when temporarily traveling outside of the United States? And what does it cover? So for members who may be temporarily traveling outside of the US, you can receive urgent or emergency medical care. You may need to pay up front and then submit a claim to your health plan for reimbursement afterwards. So we encourage members to check their EOC for specific information and phone numbers or the right websites to use prior to traveling abroad. And then another question, the last question for this section is, well, why do members in the basic PERS Gold or PERS Platinum plans contact Included Health for assistance and information when the plans are actually administered by Blue Shield of California? So with this latest PPO contract, we wanted to create an even better PPO healthcare experience for our members by enhancing the care coordination and healthcare outcomes for members, as this is something that is typically lacking in the PPO plans. Included Health is our answer to do that, and their team offers members assistance in finding in-network high-quality providers, receiving second opinions, or answering questions about a medical bill. Included Health also expands access by providing a supplemental network of virtual primary care, virtual behavioral health, and virtual urgent care services, something that we wanted to add to our program to help provide additional access to our members. Now moving to the PBM or Pharmacy Benefits Manager, a couple questions on that. First question is, will members be able to view the formulary and see which drugs are covered and their cost during the open enrollment period so they can make an informed decision? So yes, both of the basic and Medicare formularies will be available to members to view on the dedicated CVS website for CalPERS members during open enrollment. We're in the process of finalizing all those materials right now, and the formulary will provide the tiering for each drug, and the tiering is the piece that determines the copayment amount. The tiering information can be found in our health benefit summary, and none of the copays are changing for next year. We're using the same tiering structure, but by moving to CVS, some medications may move to a different tier. Next question, will members continue to have automatic mail order prescriptions? So yes, the mail order pharmacy will change, but the mail order delivery will continue to be an option. So our mail order prescriptions will transfer automatically to CVS, and CVS will notify you prior to the transition if any action is needed. This program was mandatory for basic members under Optum, but will now be optional for both basic and Medicare members through CVS. Mail order was always an option for our Medicare members with Optum and will be optional for everyone with CVS. So the follow-up question on that one again is, will members be able to get 90-day prescriptions at the pharmacy instead of mail order? So yes, commercial or our basic members will again be able to get their 90-day supply of many medications through their retail network pharmacies as well as mail order. This was always the case for our Medicare members. So there's a change to allow basic members to get their 90-day prescriptions at their network pharmacy. And those are all the answers, or all the questions and answers I had. So Vanessa, back to you.
Thanks, Rob. So once again, to learn more about the Pharmacy Benefits Manager transition, join us next week on September 18th at 10 a.m. Pacific time for our webinar with CVS, as Rob mentioned earlier. So a reminder will be emailed as we get closer to that date. So keep an eye out for that if you'd like to join, and there will be an option for you to submit questions for that as well. And that concludes our presentation today. Questions answered will be posted online next week by the end of next week. And then this Friday, we'll send you an email with a link to a short survey about our webinar today. So please provide your feedback. It's very important to us, and it helps us plan for next year. So thank you everyone for joining, and I hope you have a great rest of your day.